So I'm interested in how researchers in fields such as psychology or biomedicine have reacted to your results, or maybe adapted to your results. Do you think that there's now an appropriate level of caution and skepticism in interpreting published results? Or would you say the general understanding of your work is kind of superficial?
It's very difficult to give an answer that would cover every scientific field, because I think that the main characteristic of what's going on now is that there's very large heterogeneity across different disciplines. So there are lots of scientific disciplines that have long had a very rigorous pattern of conducting research and have adopted practices for replication and for stringent statistical thresholds and collaborative work, teamwork, data sharing, sharing of protocols, materials, and everything, transparency being very prominent. And I think these were doing very well, and they continue to do very well. There have been others that probably had very little of that or even none of that. And the uptake of such practices and processes has been fragmented in many of them. So it's difficult to give an answer that I could give like an average number, because maybe
Right.
that would be misleading. But I'm pleased that more and more scientists and more disciplines pay attention to some key themes. And I think that in many fields we have seen clearly major improvements over time.
How about practicing physicians? Do you feel like they have an appropriate level of skepticism for published results? Or?
I think that physicians are a very interesting group, because they're at the interface between science and application to health and patients, and obviously this can make a big difference for our lives. There's probably increasing awareness of the caveats and biases and limitations that exist in medical evidence. I think this is beneficial because people are now asking for more rigorous evidence, and they're not happy to just say that this is the way that we have been doing it all along, and we will continue doing it this way because this is what our textbooks say, or this is what I learned in my training from my professor. People are asking for more rigorous evidence. We still have a problem that probably training is not uniformly rigorous in terms of evidence-based medicine principles of research, not only design but also appreciation and interpretation of the results. And clearly there's also some additional stakeholders and factors in biomedical research that make the situation more complicated. For example, some of the financial biases are probably of a different magnitude compared to what one might see in other types of research. There's plenty of stakeholders ranging from hospitals, healthcare systems, insurance companies, advocates, companies, industry, and trying to align the interests of all these players is not easy.
Mm-hmm.